Welcome back to Bread and Butter Primary Care. I'm Dr. Stokes, and today we are talking about type 2 diabetes monitoring. How often to check the A1C. So, this is a question that comes up when you are treating people with type 2 diabetes. You've got them started on medication, you've got them started with some lifestyle changes. How often do you need to see them? What do you need to check? How often do you need to check those things? That's what we're going to be talking about today. So I'm excited for that. So with type 2 diabetes, the main thing we're monitoring as far as just controlling the sugar is the A1C. We've talked other videos about what that is, but just briefly, the A1C is that measurement that gives you a 3-month average of someone's blood sugar. It ranges anywhere from 4 to upwards of 16 and 17. 6.5 and above is diabetes, and so that's what the A1C is. And so when we have someone with diabetes, oftentimes the goal A1C is different depending on the person. Generally speaking, the goal is 7.0. With older patients, patients with a lot of comorbidities, it might be higher or lower. Actually, it's going to be a separate video on A1C goals and some of the new information that's out about that. But generally speaking, we want to get that A1C in the 7 or so range, keep it there or lower in order to prevent the complications from type 2 diabetes. So, the A1C is a measurement of the amount of sugar that is attached to the red blood cells, and that's why it's a 3-month average, because red blood cells live for about a 3-month period. So you can check the A1C and get a sense of what the blood sugar has been over 3 months. So given that, you would think, well, obviously we probably check every 3 months, and that is the case sometimes, especially if people are chronically treated and you've been seeing them for a while. Usually what I do with type 2 diabetics is anytime I make a change in medication, I have 2 different options as far as when to see them back and how to decide if we need to further change the medications. One is just a 3-month follow-up and recheck of A1C. The other is a 1-month follow-up with a check of a sugar journal that they have kept doing AccuChecks at home. Blood sugar checks. And so you have a patient come in, let's say they're on metformin, they're doing the diet lifestyle, their A1C is still 9, and so you start a DPP-4 inhibitor. So you put them on Januvia, 100 milligrams once a day, and say come back in 3 months. So they come back in 3 months, you check again, see where it's at. Now you know you have 3 months on both metformin and the DPP-4. What's the A1C? Should we do something else? And so that's one way to do it. It prevents really frequent doctor visits if you have patients who can't come that often. I do sometimes have initiated new medication, see you in 3 months. Now, with people who are new to diabetics or people who are very poorly controlled and I want to move faster, sometimes what I'll do is a 1-month recheck with a sugar journal. So what I tell patients to do is only check your blood sugar once a day. I think that sometimes we fail to appreciate as healthcare providers how painful and irritating it can be to check your blood sugar multiple times a day. The Lancets and the things are the technology is getting pretty well, and it's not a horribly painful experience, but poking your finger and squeezing blood out several times a day can be very irritating. Your fingers end up getting sore. And so unless it's necessary to adjust the medications based on the blood sugar reading, which really only happens if they're taking mealtime insulins, it's not necessary to check more than once per day. And so I'll tell people, check your blood sugar once a day, but move when you check it. So do a cycle. And the cycle is before meals and before bed. So day 1, you check it before breakfast. Day 2, you check it before lunch. Day 3, you check it before dinner, and then day 4, you check it before you go to bed. And then you start over again. Breakfast, lunch, dinner, bed, breakfast, lunch, dinner, bed. So in 1 month, you can come back and you can have a piece of paper and we can see, 6 to 7 breakfast sugars, 6 to 7 lunch, 6 to 7 dinner, and 6 to 7 bedtime sugars. And so then with that information, you can almost calculate an A1C a little bit, even though it's not been 3 months, just knowing that a An A1C of 7.0 is about an average of 150. So if they're on metformin, you start a second medicine, they come back in a month with their sugar journal, and you're looking at them, and it ranged between 120 and 180 and was never outside of that range, you're probably looking at an A1C around 7-ish. And you know that information after just 1 month. And so then you can say, you know what, this looks good, just continue. Now we'll go ahead and do the 3 months, check the A1C and see where we're at. If they come back and it's like every sugar is above 200 and they're 200 and 300 all the time, then after just 1 month you know that metformin plus one medicine still isn't there, and it allows you to ramp up their treatment a little bit quicker. Now, it depends on the patient. Some patients can't come in that often, and those types of issues. And so there's not a right or wrong answer here, but generally speaking, when you're trying to monitor the A1C, monitor the blood sugar, and adjust for the patients, that's what I tend to do. Either 3 month new medication, 3 months, let's see where it's at, or new intervention, 1 month with a blood sugar journal. Now, how often is it that patients actually come back with a good journal? That can be tricky. And so it's actually a lot to ask of someone to record that and be consistent in those types of things. And so I have run into that issue where they come back in a month and you're like, all right, how's it been doing? Like, oh, I forgot to bring my paper, or I didn't write it down. But hey, this morning it was this. And you're like, okay, well, that's kind of hard. Not enough information to go off of. That might be another reason why to do the 3 month and the A1C check. So you have to kind of determine which patient you're dealing with and when to do that. So as far as monitoring the A1C, adjusting the treatment, that's how I approach it. Generally speaking, every 3 months. If you're in a hurry, you want to kind of rev things up a bit quicker, you can do 1 month with a journal. But don't have people testing multiple times a day unless they have to, save them that aggravation. There's a separate video talking about other things that we monitor besides the A1C. So with diabetes, obviously, we monitor the kidneys and the feet for neuropathy and the eyes and that type of thing. So separate video about comorbidity monitoring, but this is just about sugar monitoring, how often, how to approach it. I hope that's helpful in some way for you, and that you have a great night.